Welcome to our video entitled What to Expect After Your Lung Transplant. Our goal for this video is to answer your frequently asked questions about how things will go during your hospital stay after your lung transplant. We hope as you watch that you will learn what you can do to help your new lung or lungs. People often ask, how long will I stay in the hospital after my transplant? If everything goes as planned, you will be in the hospital around 2 weeks. However, being ready for discharge will be based on your medical status, and your team will determine when you have reached all the appropriate goals. How are my transplanted lungs different? Your new lungs no longer have nerve attachments to send signals to your brain that you need to cough. This will mean that you need to practice coughing on purpose to ensure that your secretions are moving. As you recover, moving your body will help your new lungs open and function at their best. Your nurses, along with physical therapy, will help you move as you recover. What can you do to speed up your recovery? First, be active. Moving is the best way to help your new lungs inflate, minimizing the chance of complications after surgery. Additionally, you'll need to use your Incentive Spirometer. Cough on purpose and complete your exercise programs each day. All these things will help you recover and return to the things that you enjoy as soon as possible after surgery. Please see our separate video entitled Introduction to Breathing Exercises Following Lung Transplant Surgery. You may have an Incentive Spirometer at home, and if you do, you can practice before surgery. You will also be issued one after surgery. While at the hospital, we will expect you to take 10 slow, deep breaths per hour when you are awake using your Incentive Spirometer. It's important when completing these breaths that you breathe in slowly, focusing on technique. This allows portions of your new lungs to open and improve your breathing ability. Earlier, we told you that your new lungs can't send signals to tell you that you need to cough. Therefore, you need to cough on purpose to ensure that your new lungs are clear. You should plan to cough after using your Incentive Spirometer, after moving around, or any time you've been sitting still for more than an hour. Coughing can cause pain at your incision. To minimize this, it's important to put a blanket or pillow over your incision and hold it firmly in place when you cough. This is called splinting. Splinting will allow you to have a stronger and more productive cough while limiting pain. Coughing will help you to avoid post-operative complications such as pneumonia. When you wake up from surgery, will you still feel short of breath? For many patients, the answer is yes. Some shortness of breath or increased work with breathing, especially when moving, is normal. This feeling can cause patients to feel anxious about moving. When this happens, it's important to remember that you have new lungs. While you are experiencing a feeling like feelings you had before surgery, it's really not the same. When you feel like you're working to breathe after surgery, you are helping your new lungs to fill with air. Working through this feeling while being monitored by your healthcare team is an important part of your recovery. You need to recover from your surgery before you will see all the advantages of your new lungs. As you recover, your shortness of breath will improve. Many patients have questions about how active they can be following surgery. It is important that you get out of bed and move, as this helps your new lungs fill with air and helps you maintain your strength. Physical therapy will begin working with you on your first day after surgery. Your physical therapist will help you work on your ability to move independently, your strength, and your breathing. Your physical therapist will provide an exercise program specially designed for patients following transplant. These exercises will focus on proper posture, chest and arm movement, and deep breathing. We will provide a copy of the exercise handout for you to use when practicing between our visits. Our goals are to help you avoid pain and maintain movement while you heal from surgery. Please see our separate video entitled Introduction to Exercises to Do After Surgery. Patients regularly ask, how hard should I push myself while I'm healing? In order to gain strength and independence, it's important to push yourself as you recover. When you are moving, it's important that you monitor yourself for symptoms such as dizziness or significant shortness of breath and report them to whoever is helping you. At the same time, we want to make sure that you are pushing yourself to gain strength. The goal with exercise is for it to be somewhat hard. If an activity becomes hard or very hard, we need to slow down or stop and take a rest. While you are in the hospital, your physician orders will ask that you are out of bed in your chair 3 times a day. Ideally, this will mean that you are sitting up in the bedside chair to eat your meals. You will also be asked to walk in the hallways 4 times a day. As mentioned earlier, these activities help you avoid complications and recover quickly following surgery. While up, please remember to complete your exercise program and use your Incentive Spirometer. After lung transplant, you will be at increased risk for infection. You can decrease this risk by washing your hands or using hand sanitizer each time you return to your room. You can also help by reminding others, whether they are the healthcare providers or visitors, to do the same. You will need to wear a mask anytime you are outside of your room. Remembering these important safety precautions will help you to minimize your risk of complications as you recover. After surgery, your precautions will depend on whether you had a single lung transplant or a double lung transplant. If you had a single lung transplant, you will have an incision on one side of your chest, and these precautions would only apply to that arm. If you had a double lung transplant, you would have an incision across the front of your chest, and these precautions would apply to both arms. Your precautions are no lifting, no pushing, and no pulling greater than 10 pounds. These precautions will last for 6 to 8 weeks and should last until your doctor tells you that you're okay to use your arms normally again at your follow-up visit. Following these precautions will help your incision to heal and will help minimize pain. Depending on the amount of strength you have in your legs, these precautions can make it harder to move. Your physical therapist will show you how to move while maintaining your precautions. Additional information is included in a separate video entitled Precautions for Patients After Lung Transplant Surgery. When your medical status allows, you will be discharged from the hospital. The goal is for you to discharge to your home with assistance from your family and friends as needed. Occasionally, additional services may be required to help you, and in these cases, home care or rehab services will be discussed with you prior to your discharge. After you are discharged, it's important that you continue to be active. You should be working toward a goal of 30 minutes of walking or continuous activity daily. You will have exercise programs provided by physical therapy for breathing and strength. Please continue to complete these daily, pushing yourself to achieve a somewhat hard level of intensity. Wear a mask when you are around others. Wash your hands and ask others to do the same. As you continue to heal, make sure to report any new signs and symptoms to your doctor.